Let's give everyone a second to hop on. I'm going through our list to see if we have our members. Sherry and Dr. Smith, I see you both on, but I know there's a couple more TAC members that were joining. While folks are hopping on, it would be helpful if you could change your all's, edit your names, so that way we could see who's in the room. If you can, that would be awesome, so we know who we have here. And then we don't have to do a round of introductions. We could just enter in the chat.
So you need us to type our names into the chat if we're present and who we represent, or?
Yeah, that would be great. I think that would be helpful. And then also, I know sometimes if folks know how to do it, you could also change your name on your screen so we know who's here and what organization you represent as well. All right, I think we could go ahead and get started. It looks like we have a couple of our TAC members here today joining, so that is great news. I see a couple folks that are here. So members that I have present are Sherry Dymar with Kentucky PTA. I have Michael Flynn with the Frisky Coalition, Dr. Smith from the Kentucky Psychological Association. I see Donna Grisby as well that is here. Any other TAC members that are officially on our TAC group here present that I'm missing? I hear none. Charlie, please correct me if I'm wrong, but we do have a quorum, which is very exciting news.
Hi, Mehek. It's Veronica with Medicaid.
Hey, Veronica.
How are you? So I know you see Charlie's name, but it really isn't Charlie. So she's still out. That's Donna Clark that signed in on Charlie's behalf since Charlie created the invite. But it did sound like, I think I heard you call off 5 names. And then right? Yep. Including you, 4 names and you. Yeah. That's a quorum.
All right. Well, that sounds great. That's a success. Well, I think we've kind of navigated introductions and welcome, and we've established a quorum. Again, as you guys are hopping on, please put in the chat your name and organization so we could go ahead and note that you were present for today's meeting. I know that it's been a while since we met, so I just wanted to say thank you for joining us. I know it's been a struggle this past couple years, especially with COVID. So just wanted to say a moment of thank you for joining and truly appreciate you here. There's a lot of issues that we as a Commonwealth are facing. And so with our new business, I know there's a couple major pieces of discussion. Both of them came from the physicians group. So Dr. Risby, I just want to mention that the other piece that you saw on their vaccine coverage for kids, that was something that Dr. Richardson pointed out to me And I know you're probably well aware of this issue, but wanted to flag it because we were talking, I know in particular you wanted to talk about COVID-19 vaccinations for kids. So those are our 2 items of business that we are going to be discussing today. Dr. Grisby, do you want to kind of take the lead of talking about COVID-19 vaccinations for kids?
Certainly, I'm happy to kind of talk about it. I guess I had some questions, and hopefully our colleagues from Medicaid can talk about this as well. So the COVID vaccine was recently approved for emergency authorization for children 5 to 11, and it continues to be studied in the younger children as well. And so I know in some areas, particularly, and I'm just familiar with what's going on in Lexington, and that's why I wanted to bring this up, was so folks that are aware of how we're rolling this out throughout the state can tell us a little bit more about how it's going. I know that in Lexington and Fayette County, the health department is doing several clinical sites through schools, through their clinical site, and UK also has a clinic that's up and rolling as of yesterday, where anyone from anywhere locally can come and register and get their child vaccinated. But I wasn't sure how it was being rolled out in other areas. So that's why I wanted to bring this up, to make sure that, and I'm sure very smart folks at the state level have been working on this and getting it up and rolling, but I just wanted to make sure that they felt like they had the mechanism to get it out to all of the areas that we need to get it into. So.
Yes, this is Lee Geis. I'm with Medicaid. And I'd like to say that as far as how it's being rolled out across the state, we would actually have to check on the Department of Public Health's website for a statewide effort. But I do know that there are individual school districts that are setting up clinics, just like the way that you talked about Fayette County. I know that's happening in Jefferson County. I read something in the newspaper about that. And happening other places. The health department certainly will be able to assist with those vaccine clinics all around the state.
Okay.
Yeah, and this is Veronica with Medicaid. I just want to add, so the county has started a social media campaign. You'll start seeing on Facebook and Twitter and all over the social media about now that kids 5 to 11 can be vaccinated. And I didn't see Angie Parker on, but our managed care organizations have a work group around outreach for vaccination to increase vaccination rates. So I'm sure that they're going to be working on their own outreach efforts to try to get these kids vaccinated. So those are a couple of additional activities.
I do know as well that the Vaccine for Children's folks at the state level are reaching out to the individual practices that have that program to say, hey, are you all interested in doing this in your clinics? How can we help with that? So I feel like the VFC sites are getting information and the ability to try to work on getting that up and rolling. I wasn't sure where other efforts were being focused at that time, at this time as well.
So I do want to point out that. Well, I'm sorry, I lost my train of thought completely. Looking right at the screen, I do want to point out that Medicaid will be covering the administration of the vaccine to children outside of the VFC program as well. I mean, VFC covers the cost of the vaccine. And as far as I know, this vaccine comes to us the same as the adult COVID vaccines have come, which is at no cost for the actual serum. So we will be covering the vaccines for children, and the new administration codes are in process to get into our system, and they should be out on our fee schedule sometime today.
Lee, is there going to be a notice that is being sent out or any information to providers? Like how are providers knowing that it will be added to the fee schedule, and you know, what can we do to help? I'm just want to think solution focused.
Well, because 90% of our members, and certainly probably more or a higher percentage of children are in fact members and enrolled with MCOs, we are hoping, and we will certainly be checking on this just to make sure that they're reaching out to their provider networks to let them know that the children's vaccine is ready to be administered. And as soon as they look at our website and see it on our fee schedule, everyone will know that what the rate is and what will be paid for that administration. But no, we had not planned on sending a letter out, mostly because the social media campaign for members, like Veronica talked about, and the fact that the MCOs have a much greater reach into the provider community than Medicaid does. And we're hoping that some of our community partners step up and step out, like KMA, like any advocacy groups that you all might be associated with, any other advocacy groups that there are. We're hoping that between the MCOs, the social media campaign from the cabinet, and our public advocacy groups will be able to spread the word. I mean, are you finding that physicians don't know that the vaccine's available? It's hard for me to know because we hear about things all the time. You know, we get an email about items like that. So I don't even have to wait to hear it on NPR. I already know it. So it's hard for me to know what information's out in the community.
I feel like that between the information that's gone out to the VFC sites and the information that's out in the kind of the news world, that most providers should know that it's available. I feel like that what we see, and this is probably true for U of L as well, is that providers in our community that are in private practices are reaching out to us to see, are you all getting the vaccine? Are you setting this up? Can we send our patients to you? So I feel like in the larger communities, they're reaching out to the bigger healthcare entities to make sure that their patients can get the vaccine. So I feel like most physicians should know that, most providers should know that, but I guess I was just interested in what's happening. I know what's happening here. I want to make sure that there's stuff, you know, happening in some of the rural areas and some of the areas that are outside the big metropolitan areas, to make sure those kids at least have an opportunity to get vaccinated.
Yeah, and I think that's my concern too. I think the bigger core areas of the Louisville, Lexingtons, Northern Kentucky, there's systems in place there, but for your rural areas, just thinking, you know, what are we doing to improve rollout? Is it necessary to have like a letter or some sort of communication? You know, what can we really be focusing in really improving those vaccination rates? Because even from my understanding, that 12 to 17-year-old population isn't getting vaccinated at a high rate at all either.
Yeah, there is this is Veronica of Medicaid again. This is there is an internal work group here at the cabinet that's also looking at equity and the vaccine, and we're pulling data to show, you know, where are the inequities, and we're going to use that information along with working with the MCOs to try to cover those areas better. And so this definitely will be part of that, is this age group. I did want to also note that we did post on our website, our Medicaid, Kentucky Medicaid COVID-19 website. We posted about, you know, the coverage now for children. But to Lee's point, we really need good partners like you all, you know, going out on your social media and broadcasting it, talking about it in any meetings that you go to, you know, helping us get the word out.
Thank you. That's helpful information. And I'm glad we're all seem to be working on it together, or at least we're all working on it. So
Absolutely.
I just wanted to give a second if the MCOs wanted to respond, because I know you all are heavily engaged in this process too, and kind of if you want to share anything that you're working on with in regards to the rollout.
Good afternoon. This is Beth Goodman with Passport Health Plan. Can you guys hear me? Wonderful. And so we have been just rolling out communications to our providers. I'm a provider rep in Region 4, DMS Region 4. And I can say, I just looked, we had on the 4th sent out an e-news on the DHP pediatric COVID vaccine webinar that went out. So we are, you know, doing our level best to make sure that our providers are aware of what's going on.
Thanks, Beth. That's great. Others? Or if you have pages of information, if you want to put that in the chat or anything along those lines, feel free to do so. I think that information is very helpful. I know, speaking from an advocacy lens, not necessarily a provider, but just sharing your all's pages, or just, you know, we get sometimes random calls of like, where do we go? What do we do? It's helpful. And that's certainly something that we could post on our blog or social media channels of, you know, if you have any questions, please go to this page for United, go to this page for Passport, go to this page, you know, for the, you know, all the MCOs. So just wanted to give that update too. If you guys have resources or links that you want to share with us, that's always helpful. Anyone else want to chime in from the MCO world?
This is Tom James with Passport, and because I am a pediatrician and part of the Kentucky Pediatric Association, that's why I try to make sure that we're advocating for children.
Thank you for that. Well, I think the next topic is quite in line with what we were just talking about as well. And like I mentioned on top of the hour when we got together, that Dr. Richardson, who used to be a part of this group, shared with me around just that many healthcare providers are unaware that Medicaid will pay for vaccines outside of VFC, is what she said, or they're not confident in what they'll be paid for based off the current fee schedule. So she was wondering if DMS could create a provider letter to emphasize vaccine coverage for children of all ages is available by submitting charges for vaccinations and administrative charges directly to Medicaid's MCOs outside of the VFC program. And then those providers who opt out of the program, they often send children to other facilities for those vital vaccines. And given the fact that our current status is low for vaccination rates, you know, we want to utilize as many opportunities as we could possibly do. And so that was just one piece of just note that Dr. Richardson shared. So I don't know, Donna, if you have anything else to elaborate, or if you're familiar with the issue, or others on the call, but I just wanted to bring this up because it seems very in line with what we're talking about.
Mahek, was she referring to children who don't have coverage otherwise for their vaccines, or?
I believe so. That was my understanding.
Okay. And I will tell you that one of the many negative consequences of COVID has been that there have been patients who have not presented for their typical preventive care visits or for their vaccines. And so we've seen the vaccine rates go down dramatically across the country because, you know, either non-essential visits were not prioritized for a period of time, or folks just really got concerned about bringing their children in for well child care. So I'm not sure what else Dr. Richardson was concerned about, but certainly we know this is a time where we could certainly use support in getting information to patients that, hey, it is safe for you to bring your child back in for their vaccinations. You know, it's less safe for them to be out in the world and not vaccinated against some things that we may see increase because the vaccination rates have dropped.
Yeah, I think, oh.
Yeah, just let me say this. This would be a perfect time for the MCOs. If you all have anything in particular that you're doing for outreach on well child visits, etc., this would probably be a good time to bring that up.
Hello again, this is Beth with Passport, and we are hosting our provider forum, and it's on the 17th of this month, and the topic is actually EPSDT. And so all that information is on our website.
Beth, do you mind following up and sharing that so we're not digging through?
Oh, of course. I'm sorry. Yes, my pleasure. I will do that right now.
Awesome. Thank you.
This is I'm sorry.
Oh, sorry about that. This is Audra Summers with Humana. As far as EPSCT outreach, we do have direct outbound calls to the families of children who are missing those well child visits. Additionally, we utilize other broad reach strategies such as text messaging, voicemail, or email, that sort of thing, to outreach to our families as well.
And this is Michelle with Aetna Better Health of Kentucky. We host our provider virtual office hours bi-monthly, and we have also promoted the EPSDT and trained on that, as well as texting campaigns. These items are just beyond our normal scope of outreach.
So, I'm pretty sure that everybody's aware, and as far as MCOs are concerned, about the lack of preventative visits for the period of COVID in particular. If I'm not mistaken, and I'm not 100% sure about this, if I'm not mistaken, it's one of their measures, one of their quality measures. And I'll be quiet now, Michelle, and let you talk.
Oh, I was finished. It's just beyond our quality. You summed that up correctly, because we are doing constant outreach in those areas.
I think two of the pediatric that you're alluding to, that two of the pediatric quality measures, one is around well child care and or preventive visits for children 3 to 5, I believe. And the other is vaccination rates, right, in both of those groups, in the younger and the 3 to 5s.
Hi, this is Ivana Dickey, part of the quality team with Passport by Melina. And yes, there is one quality measure for well child visits for members age 3 to 21. And then there is another one for members age 0 to 30 months. And our outbound call center team is making outreach for these and touching on care gaps for immunizations as well. And we do have a quality specialist outreach team that for our largest volume practices throughout our regions in the IPAs and health systems, we have care gap reports available that cover well child visits and childhood immunizations for those HEDIS measures.
Others?
That's helpful. Thanks to your teams for helping reach out to families. And I think a lot of practices are also trying to do callbacks for folks that they know sort of got lost during the pandemic, but it's very helpful to have your assistance in getting families back in. So thank you for that.
Thank you. And like I mentioned, if you guys don't mind sharing this information with, you could share it with me and I could send it to the TAC members or whatever process. I think that might be the easiest process, but just so they have access to all this information that you're working on and what you're doing, it's always helpful that we could just at least have something to share. So that would be very helpful. So moving on, I wanted to take a second just to discuss, are there any other topics that our TAC members want to discuss and dive into?
Mahak, do you mean today or just going forward?
I think today we have time. Those were just 2 that were sent over, but not everyone had a chance to send over any ideas if they wanted to share any. So I just wanted to allow some time if someone wants to talk about any topic. I know for us at Kentucky Youth Advocates, today's a huge day. We released our 2021 county data book, which this is our 31st edition of this publication. And this year we disaggregated data by race and ethnicity. We talk about the systematical racial injustice that impact our children and families of color. And we talk about solutions to advance racial equity. And so I know every year I usually bring a copy in person, but since we are virtual this year, I'm happy to forward an email with all the information where you could read the book. You could also read our press release. You could also just look at our data that is on our website so you don't have to dive into the whole book. But I just wanted to share that announcement because that is something I know we often say data kind of helps guide and leads to change. So that was just one update that I had that I wanted to bring to the table. I don't know if other TAC members have any other updates or just any topics that they want to discuss.
Congratulations on the release, Mahak.
Thank you. A lot of labor of love. If I look tired, that's why. All right. Well, I know one big thing that we always talk about since this is our last meeting until the new year. And Veronica, I don't know if you could help out with this, or maybe we could just do it via email, but usually we have a schedule. Like in November, we talk about the schedule for this upcoming year. So I just wanted to share I just want to ask a couple questions. Does this time still work? Do we still want to meet virtually? I know quorums have been difficult to come by during this last year, but I just wanted to take a second to ask, does this time still work? And do you still want to serve on this TAC? Because I think as we move forward, I know our goal is to present some ideas to the MAC, and unfortunately we haven't had quorum to present ideas. So I just wanted to take a second to just open up that dialogue before asking Veronica if we could go ahead and schedule for 2022.
The time works for me. It's a great time, and I appreciate having the virtual option, but I'm glad to come in person if that's what everyone else chooses or votes for. I wasn't on the TAC when we were in person, so I'm sure there were parts of that that were maybe a little bit more rich in terms of conversation and just interactions, or we could even set a goal to have 1 or 2 of them a year in person and some other virtual options other times. I don't know what has been working for other people.
The heck, we're fine with the time. 2 to 4 is fine. And I'm also fine maybe with like a hybrid of some in person and some virtual. That'd be fine for me too.
Awesome.
And I'll add too that like the time's good for me. I'm going to be honest with you. I prefer face-to-face meetings. It's just too easy for somebody to step into my office 5 minutes before a virtual meeting and say, we've got to have you, you've got to do this. And then it pull me away. If I've already left an hour before to travel to the meeting, they can't do that to me.
I totally get that. Pat, I noticed that you're on, I'm sorry if I missed you earlier, but just wanted to ask, I know we're talking about 2022 schedule, so I don't know if you have a preference.
Either is fine with me. I'm kind of like the gentleman that just talked. It's easier if I'm out of the office because there's either a phone call or again, some interruption. So either is fine with me.
Awesome. So it sounds like the time still works for everyone. Dr. Brisby, does it? I saw you shaking your head. So
yeah, it does still work for me. And I feel like when we've been meeting virtually, we've been more likely to get a quorum because I feel like there are things that kind of interfere with folks getting here sometimes, like weather or other things like that. But I'm happy to do whatever the group wants to do. And if there's a hybrid model, I'm fine with that as well.
Veronica, a question that I have, knowing that the rules kind of changed with TAC allowing this nature of virtualness, is there still, like, as we move forward into 2022, will there be an opportunity that if folks want to join virtually, they can, and if they want to join in person, we could totally swing that? Just so, yeah, just to meet, like, find a middle.
Sure. So the department right now does not have the capacity to in any, I would say, good way to do a hybrid of an in-person and a virtual. I will share with you that the TACs and the MAC, the conversation has been to stay virtual, especially through the legislature and the winter. So the first of next year. And we are in the process of obtaining that capability. And my hope is that we'll be in a good position to offer that to the MAC and the TACs at some point next year, early to mid next year. So most of the TACs have said, well, let's follow the MAC and stay virtual. And then a few of them have even said, once the department indicates that they have the capability, then maybe we could move to that. Now that doesn't say that if you all decide you absolutely want to do that, we can, the challenge is that most of the facilities here in Frankfurt, I know the LRC has facilities that can have that capability, but in the session, they'll be utilized for that. And so they're just limited capability or facilities around Frankfort that gives us the option to do that. So, you know, again, I mean, we will, if it's the TAC's desire to do a hybrid, we don't have that capability currently at the department, but we could try to help find a location, or, you know, the other option is just to stay virtual until we can let you know when that's possible.
That sounds good. So should we just stay virtual and reassess after the first meeting? Is everyone okay with that for at least January's meeting? And then we could, hopefully by January, we will know something. Not to put pressure on you, Veronica, but if we could have an update of the possibility, that way, you know, at that point, we could plan ahead.
Absolutely. And Charlie is who's been working on that. So I just don't have a sense of when that's going to happen. Okay. You know, it has required procurement of the capability. So that's always challenging. And the other thing, you know, as far as I know, there's nothing that conflicts. You all have been doing, I believe, the second Wednesday, 2 to 4 of the month that the MAC meets. And I don't know of anything that, you know, is conflicting with that. We always try to make that work from the department's perspective. So if you wanted to continue with that, I could quickly write down what those dates are and then read them off.
Yeah, I think that would be helpful. I'm assuming January 12th.
So yeah, definitely January 12th would be the next meeting.
Okay.
It looks like March 9th. May 11th. July 13th. September 14th. November 9th. That'll be it.
Yep. All right, so I have January 12th, March 9th, May 11th, July 13th, September 14th, and November 9th for 2022 schedule. And it sounded like everyone that is present is willing to stay on as a TAC member for 2022. I see shaking heads, so I'm taking that as an affirmative sign. So that sounds great. I'm glad and I'm happy to hear that. And I did want to take a second just to say thank you for doing that, and thank you for being active and engaged. We do need to think about our next meeting. I don't want us to be in limbo like we were this time, and figuring out if we're going to have a meeting and if we're going to have a quorum last minute. So can we take a second to think about what we want to discuss for January, and we could line up a speaker. Typically, I know Dr. Smith, you're the newest a part of this group, is what we try to do is have a speaker speak about a topic, and then that helps us form some recommendations that we want to bring to this group and have a discussion around. So with that being said, I know in the past we've spoke about dental health, we talked about mental health as well, and behavioral health services and having access to behavioral health services. We've talked about tobacco issues and just providing cessation programming and prevention of using tobacco products. Obviously, I'm just trying to think if there's anything else, like we're touching on vaccines right now. Does anybody have any strong opinions or feelings around what our topic for January should be, or something that you've been hearing or seeing that we need to address? Pat or Michael, anything in the schools? I feel like we've pushed away from school-based. for a second due to COVID.
We may, instead of saying anything, we should say what would be different for the schools, because it's a little crazy over the past year and a half. We're just seeing low vaccine percentages. And I'm not talking about COVID, I'm talking about all their vaccines. A lot of parents have not taken their kids over the past year and a half. So we're seeing lower numbers. And the same thing with just their basic physicals, vision screenings, dental screenings, everything. They've just pushed all that back, and I guess just didn't want to take the chance and go into the offices. So those are things right now that we're trying to get kids back into the normal school routines and still deal with COVID at the same time. So yeah, it's a challenge.
And I would just add to that we're seeing a very large number of students who are opting to go to homeschool, having doctors write permission to go to homebound students, because the anxiety levels of students are so high from having been out of school for a year and a half and being virtual, and being, some of them are afraid of the virus, and then others just, you know, are kind of become, it's really just something I've never seen before. I guess none of us have, but we just have a large number of schools and districts that are seeing lower attendance rates, and lots more kids receiving services as far as mental health services, and a greater need for mental health services. We're going to be seeing the impacts of this on the schools for years to come.
I would agree and just say that what we've seen a lot in mental health is children who actually kind of thrived, I'll say in air quotes, with NTI, because they were the kids who really didn't like school to begin with. So there was some kind of acceptance over, oh, you know, I don't have to go to school, with social challenges and otherwise, who are really having a hard time. And like you say, are trying to opt for other options rather than returning. So kind of that avoidance to get back to school, which, you know, is unfortunate. And I agree with you that it's going to be a lot of years to have this hopefully get back on track.
So I know that topic could be overwhelming just because there's so many layers added to it, but it sounds like one that we need to discuss, or at least open the can of worms and just dive in. So if everyone is up for it, let's talk about it. And I wonder if we could, do you guys have suggestions of who we should have speak or talk to us and kind of share the insight? I know you two are definitely ingrained in the world of schools, Pat and Michael. So I don't know if you guys want to share your perspectives of what you're seeing, or would you like an outsider? Because I'm thinking also we could reach out to the school board association or the superintendent association or whatever association group that you all dictate and kind of share. And I could happily make that connection with them.
Like, where is that element of support to help those children maybe get back to school if it needs to be gradual doesn't typically the treatment for school phobia or whatever we would want to call that is to go to school, but where is the little element in the school that could help with that, or but help a kid with a plan to get back to school, for instance. I know sometimes too, it's a trickle down from their parents' anxiety around the virus and other things. It's a multi-layered concern. And then sometimes they have siblings with health issues. In the case of the kids I work with transplants, and the parents are worried about sending their children to school. Who are they going to bring things home to their children who are immunocompromised? It's complicated.
So not as a Medicaid individual necessarily, but as a step parent of a young child, I would ask, are folks thinking about ways to make schools a little bit different in order to address some of these and issues that are going to go on for years and years? I just haven't heard, because I'm not in that world necessarily, I haven't heard a lot of discussion about innovating the structure of schools that might be able to help.
I can tell you one of the biggest problems with that is not all of your school districts have the financial capability. I mean, a lot of schools that were virtual, you know, I mean, the virtual programs that were being provided during COVID were not satisfactory to meeting the needs of students' education. And it wasn't because they were lacking in the desire to do it. It was because they didn't have the funds to make sure every kid had a device, every kid had access to the internet. When you're in your larger communities, I mean, those communities have their own struggles, but I mean, at least there is, you know, readily accessible Wi-Fi, you know, and things of that nature. But I mean, you had school districts that were doing everything on paper and pencil packets, and that were actually just getting them picked up by parents and dropped off by parents at the will of the parent. So, you know, I agree that we do need to look, and I know a lot of school districts are looking at, and have provided some alternative venues for education. There's some virtual platforms out there that some school districts are using, but when you get into your smaller rural districts, those are options are just not there financially or physically with the infrastructure.
I'm sorry, I can't participate right now because, as you can hear behind me, we've got a fire drill going on. So just hold on. It's a setting. That's the way it is.
Don't you have to leave?
I'm sure we could still talk about this issue for hours and hours to really, it's so complex. There's so many layers as mentioned. Charlie, I don't know from the PTA's end if there's any additional lens that you want to provide or what you've been hearing whatsoever on the parent angle.
I would say the thing is the mental health services. That's what we're hearing the most. And just kind of an update, like other people have been saying, an update on what's happening, what's working, what's not working. That would be the biggest thing. And plans to make it better.
Thank you for that. I think, so just trying to think through of speakers of who we would possibly have. I don't, like I mentioned, those association groups, we do have, like at least I have a connection with the School Board Association and the Superintendent's Association, but I don't know if that's if that's the fit that we want to go with or angle we want to go with. So honestly, I would be looking to you all, Michael and Pat, whenever you have a second to chime in about it. If they're the right groups or there are other groups that you all haven't, that should be presenting.
One of the things that I am seeing that concerns me, and maybe that will help us with trying to decide who would be speaking to us, when our push now is with mental health, as it should be, and there are more funds there available, but what's happening is every Tom, Dick, and Harry is hanging out a shingle. And a lot of parents don't know what to ask, like, what are your credentials? What kind of experience have you had with counseling for especially teens and even young children? So my concern is, and I know now we have broadened the types of individuals with qualifications that are allowed now to bill Medicaid and other insurances for the mental health services they're providing. But at some point in time, I really think that either us or whomever comes together as a group and says, okay, as a parent, when you're searching for help, what are the things that you need to be looking for to make sure that the person who is working with your child is truly qualified to provide the services that the child needs. It is concerning to me. I worry because I see the home hospital requests that come through, and you know, some of the people who are signing off on that, I question where they are and what, you know, and if the parent has truly, and a lot of them simply don't know. They're just desperately seeking someone to help them for their child. And again, that's just my 2 cents on that. So maybe someone from I don't know, psychology association or something like that who can kind of help us with maybe helping put something out for parents or some sort of information could be placed through the PTOs, so that they can help. And even with the school nurses, if we've got something to give to a parent, or if they're coming asking for help, or we're noticing something that needs to be addressed with their child, something that we could give them to assist them with selecting someone who's qualified to help their child. Does that make sense?
Do we feel like there is a subset of identified kids and parents who the parents really want their kids in school, but the kids are kind of refusing or otherwise unwilling and just so anxious that they can't get them there? Or, I mean, I guess I'm wondering, do we see the origins with the kids themselves or the parents? I'm sure it's both. It's a hard question to answer, I'm sure, but.
It is both. And
yeah.
A lot of the requests for these students to do home hospital or even homeschool, a lot of that is being now, for the past months, we've seen it, it's 98% mental health issues. And
but we don't, I guess, have a requirement that has to be signed by a physician?
The regulation has broadened. So there are many more individuals that are allowed to sign for that have not been allowed to do that in the past. For example, in the past, it had to be a psychiatrist or a licensed psychologist. Now that area has broadened quite a bit, and there are individuals signing that are allowed to sign and bill. But when I'm looking and searching for credentials, I can't find any. So it's a worry to me that I want these kids to get the type of therapy and all that they need. And I just have a worry that parents are looking, but they're not sure what to ask about or what to look for.
It is concerning. I would say there's probably also a broad range within disciplines some would say, oh, you shouldn't go to school. And others would say, absolutely, you need to get back to school. Do you know what I mean? Even I'm a psychologist, even within our field, I would say there would be a huge range of opinions about that. And I'm sorry to hear that it seems like it's been expanded in a way that's not helpful at all. Because I work mostly with medically ill children who also have a mental or behavioral health component, almost all of our home hospital papers are signed by their physician based on their medical condition, not necessarily only a behavioral or mental health issue. So thank you for educating me about that. Now what to do about it.
Yeah. There's the challenge.
It almost feels like that needs to be restructured again in a way.
And again, it's the emphasis now needs to be on mental health, and absolutely. I'm worried that in our attempts to provide more services or to offer that sometimes it's being handled through, for example, I'll just give you an example. Had a request for home hospital that was signed by a licensed clinical social worker. So when I asked, and it was on the form that this child was also under medication therapy as well as counseling. So I asked, who is prescribing? And she said, I'm telling the doctor what to prescribe. So his pediatrician was prescribing based upon what the LCSW was advising. So, and again, nothing personal against anybody. That's just not the way we normally in the past have handled that. So that's just an example of a concern.
So Pat, who are you more concerned about there, the LCSW or the physician?
Actually, both.
Okay, so
yeah.
because you don't really know in that situation what the actuality is. Do they consult and the pediatrician makes a determination, or because the pediatrician may not have very much mental health experience? I understand your concerns. I definitely do. The only thing I can tell you is this, that any provider that is enrolled with Medicaid does have to have all their licensure and certifications in place. But we certainly don't track and follow specialties. So I'm not sure that Medicaid could provide much help in telling you or this TAC anything about who might be like specialize in adolescents or children under 12 or whatever the age group.
Sure. There's never an easy answer. Yeah. So it's like I said, that's the challenge. We want them to get the care they need. Absolutely. I just want it to be what they truly need. I want to see progress, and we all want to see them progress and improve so they can attend school and get back to some sort of normality with their life. But sometimes I'm concerned about the route that's been chosen. Anyway, it's just my 2 cents. There you go.
It's very valuable.
Michael, I don't know if you have a second to chime in, if there's anything else that you wanted to add. I know with Friskies, it's a lot of trying to mitigate and find those solutions for families and the student, putting that best foot and best interest forward. So I don't know if you've heard even success stories that have worked that could help out.
Well, I think that she hit it pretty much on the head there with the nail, but you know, and I just wonder, are the MCOs doing anything to provide their families with information on how to obtain mental health services due to COVID anxieties or anything of that nature? So maybe we're just, I'm just grasping at straws, but if we have some kind of campaign that's directing people to, you know, the proper, like I'm sorry, I'm forgetting people's names here. And, but anyways, if we just had some form of communication going out that was directing people to the most reliable sources to find assistance in that with COVID anxiety, does that make sense?
It does.
I mean, I know we do tons of education on the vaccine itself and why it's important to get it and some of the myths and things of that nature. But, you know, one thing is there anything going out to talk about parents about how to notice if their child is suffering from COVID anxiety? You know, we've got a lot of kids whose parents are just coming in and withdrawing them from school to homeschool, which that only requires a parent's signature and documentation that they plan on entering a homeschool program. You know, but is there information out there about, you know, maybe your child is suffering from COVID anxiety and that's why you're having all these troubles at home? You know, you've got a lot of parents out there who are, you know, we've talked about it before, there's a stigma against mental health. We're not going to address mental health in a lot of families and a lot of regions. And maybe it's just something that people aren't realizing even exists.
Dr. Smith, I'm kind of looking at you.
I'm sure you are.
I don't know.
Looking at me too.
I don't know where to begin. I mean, I don't know if you have ideas or just thoughts.
Well, I think it's just so complicated because, I mean, an LCSW is a licensed, you know, in every way should be able to provide a gold standard mental and behavioral health services as would a psychologist or a psychiatrist. Unfortunately, there's just always a wide range of, you know, people's opinions. And I also think, you know, whether or not, I mean, I feel like there's been a ton out there about COVID related anxiety, both in, you know, social media, on TV, you know, like I think I've seen a lot, but that may just be me sort of drawn to that as well because of the field that I'm in. I guess I feel like, I think it's unfortunate. I think, and two, there are people that believe homeschooling is very equivalent to going to school in person. And I think we would all agree that if they're doing it because they're fearful or avoiding, then that's probably not. If they're doing it because they have certain values around that, then it's a different thing. I guess I just wish that if they were signing up for homeschool because of anxiety, they had a plan in place for return to school, you know, that was part of like, okay, this is for limited time. And I'm not sure how to make that happen. I do feel like, yeah, I'm sort of stuck. I don't know. Did the rest of you feel like you hear a lot about COVID anxiety and treatment? And I mean, it's one of, we get referrals for that here at the clinic that I work in every single day. But I'm in Louisville. I'm not, you know, in more of a rural area, but I don't know.
And this is Stephanie with AFM. We have education that is, you know, for children and parents on mental health and stress, you know, for stress as well. It currently isn't COVID specific, but we are working on COVID health education, you know, to address this topic that we're discussing currently. And then earlier, and apologize for not speaking up earlier to go back to the COVID. I'm new to Kentucky Medicaid, and this is my first time joining the meeting, but I also want to let you guys know that we have our Healthy Reward for members who receive the COVID vaccination, which will include children 5 and over. And we also have increased provider incentives around receiving the COVID vaccination. So we are working on that item as well. Just want to put that in there for Anthem.
As far as PTA goes, National PTA and also Kentucky PTA, we've had several webinars about the mental health issues that are arising due to COVID. And so there have been webinars, and we do have resources. A lot of them are a little probably more national, and there's always some people you just can't reach. You know, the same people who are listening to everything get it, but then some of them are harder to reach. And but it's going to be an ongoing thing, and we still need the state guidance, I think, for our people. You know, that they can reach out. That'll be something related to their specific state and what they need, and city even maybe.
If we had some sort of, I don't know, public announcement or guidance or whatever, school districts could easily put that on their websites for parents. Because on our website, there is a whole entire section that's devoted strictly to COVID. So if we had something, you know, if you're seeing these symptoms with your child, you know, please contact, or something along that line. So those are options that school districts have. I think they're just searching for the right information to be able to give to parents. And again, it's guidance and letting them have some options to choose, but at the same time, it's a form of guidance for this is what you look for, this is what you're seeking. So anyway.
Do we have any numbers or data on the number of kids who we think are being taken out of school because of COVID anxiety? I mean, that might be an interesting topic if someone had anything like that, if the school district, if someone from there could, I mean, and then how we think, I mean, from an educator standpoint, how we think that's going to impact over time. I don't know. I'd love to learn more about that and hear more about that, because I value children going to school and the things that they can get from that. But I recognize, you know, there are people that make other decisions, and I'm just wondering, like, how often this is happening. It sounds like you guys are seeing it quite a bit. anyway, just throwing that out there too.
Well, I can give you an example of it. Is on a traditional year, and I'm not knocking homeschool at all, because I have friends who are wonderful homeschool parents and do wonderful jobs with that. But in a small school district like where I'm in, we may have 10 kids who apply at middle school. I'm at a middle school, and we may have 10 kids a year that apply for homeschool and say that they're going to homeschool their kids and do the paperwork saying they're not going to attend public schools. This year, when school started, we started out with 20 and we're up to 50 now. I mean, and you're talking about a school that started out with 528 kids and now is under 470. And it's because kids are going to homeschool. And most of these kids are kids who, when they came to school every day, the parents were literally trying to drag them out of the car. It's just, they would come to school and refuse to go to class because they said they weren't comfortable there. They would sit in the hallways and refuse to go to class. They would stand out on the sidewalks. I mean, and it was days on days of counselors and people trying to coax that child into school and trying to find ways to gradually bring them back to school. And it just, eventually the parents get frustrated and they just pull them out for homeschool.
Okay, I got you.
I don't know if Pat or Michael, does KDE should be collecting that data, correct? I mean, every local school district should have the number of students that are applying for homeschool, and then they do have that information. The reasons why they're pulling for homeschool is home health, right?
Yeah, no, we're not talking home health. Home health and homeschool are two different things. Home health is a doctor's excuse saying you can go. The school still has to provide services to you at your home.
Yeah.
Based on a doctor's recommendation. Homeschool is when parents come in and withdraw their kids from public schools altogether and say, we're going to do the education at home.
Mm-hmm.
And what my big concern is I agree that we probably got a lot of kids. We have too many kids receiving doctors' notices saying that they need to be home health. But then we also have a large number of parents who are pulling their kids out because kids are refusing to do what they need to do at school because they say they have anxiety issues. And instead of and I'm really worried about those kids because they're, at least, the ones that are getting pulled out for home health are at least seeing some kind of doctor or some kind of counselor who is making those recommendations. Then you have that whole other caveat of students who are not, more than likely, are not receiving any services once they withdraw.
Yeah, so I wonder if we get that breakdown from KDE, because I think maybe we could ask them from for 2018 was a normal school year, 2018 to 2019, and then also see if we could get numbers from this school year and ask them to compare and contrast if that's possible for both home health and homeschool, because I think both of those might be telling a picture that we need to focus on.
I have a question too. Michael, do you know if those parents are ever requesting a 504 plan to be written for their children for anxiety?
In my school, I can tell you sometimes when we work with those parents, we try every way in the world to avoid homeschool. And actually, we try to avoid home health as well. But so we'd offer 504s. My counselor is constantly writing 504s. A lot of these kids that have withdrawn in the last 2 months. And that's after 3 months of trying different things to get kids to work with you to, find ways to make them more comfortable and things at school.
Thank you.
One of the things that our group noticed is, of course, last year, most of the schools were virtual or they were in and out, some in person, then back and forth. And this year, our staff, as well as counselors and all, have noticed that even though some of these children are high school, middle school age and have been in school for years, it's like they're starting school all over again. Like the normal things that they would expect in school, they don't have any idea. It's like they've forgotten. It's been very challenging. And a lot of those things, just like he's talking about, parents are struggling to get them to come to school, to get them to keep up with their work and participate in things. And it's a battle. The only consolation about then, and I'm like him with certain things, at least home hospital, there is a target date when the child will return.
Right.
least you have something to work toward. Now, lots of times that gets pushed out, but at least we start out with a target date. With homeschooling, once they're gone from us, we don't have any contact with them, no connection. We don't know where they are, what's going on with them. So, yeah. The DPPs in each school setting, your director of pupil personnel is the department that keeps track of home health, homeschooling, and things along that line. And I'm sure that that area is with KDE.
Okay, I was gonna say, I wonder if we could have someone from, like, is there a DPP chair, like lead at the state level? I don't know if either any one of you all know who that might be. I could do some digging, but I don't want to go blindly if someone already knows, because I think it would be helpful to have a conversation and invite them to the next meeting and share that data if they have it possible, to kind of paint that picture for us.
I can ask my DPP who is over them at the state level.
Can you tell me what DPP stands for? I'm sorry.
Director of Pupil Personnel.
Okay. I was wondering if there was an equivalent type person for the state who's over mental and behavioral health for the school too. I mean, schools, I should say. But maybe having the data first and, you know, taking a look at that. Yeah.
I'll ask him and I'll send you that name.
Okay.
Okay. All right.
That would be perfect. So it seems like that would be a good starting point for our conversation in January. And then I don't know, Pat or Michael, if you guys see success stories or anything else that has been working well. I know sometimes that's hard to find, but if you have ideas of success stories, it's good to have another model to kind of lift up when you get the data that we're asking for. So maybe that's something, if you guys don't mind thinking about that, and if you've seen something, that would be great to elevate alongside the data, to start getting our wheels turning around solutions, or at least talking about solutions. All right, so it looks like we semi-figured out what we're going to be talking about in January. Thank you all for that discussion. It seems like there's quite a need to understand what the current school landscape is in relations to COVID anxiety, and what's, why are students not attending school, or and so on, and how can we really support them. So looking at, we've talked about the schedule, we've talked other topics, we conducted new business. I just wanted to give a second to ask if there's any MCO updates. I know we didn't ask for any updates, so don't feel pressured to share anything since we haven't gave a formal ask, but if there's anything that you all want to share, please, you're more than welcome to unmute and share anything that you have. I noticed that the chat has been flooded with some just resources and materials. So thank you all. I appreciate that. So I'll just stop there to see if there's any MCO updates.
Hi, this is Beth with Passport, and I'm dropping a link in a moment. I can't multitask terribly well. So I was just going to say, since we last met, we published our Q3 newsletter. And so in that, we announced that we've joined Psych Hub Coalition. And so we can now offer providers and members access to the Mental Wellbeing Resource Hub. Also in the newsletter is vaccination tips, EPSTD information, and then we've started a 7-week series called Cooking Fresh for physicians to share with their patients on diabetes, prediabetes, and just eating healthier in general. So thank you.
Thank you, Beth. Anybody else want to share anything? And if not, that's totally fine. If you have any resources that you want to send out to the group, please feel free to email me. And then I'm just going down our list. There's really no other business. I feel like we covered it all. There really isn't. any action items either. It sounds like we are gonna, Pat's gonna figure out who the DPP contact is and email. And then if folks have any great models of success that we wanna elevate, we'll do that. But it looks like there is nothing else, so we could adjourn if everyone's fine with that. All right.
Thank you.
Thank you.
Thanks a lot.
Bye.
Thank you.
Thank you.